one thing that I think influences me when I'm progressing patients along in the rehab process is the amount of end feel. If the patient is displaying an open end feel, meaning I could bring that shoulder throughout the full range of motion, I'm probably not going to do it. I need to let them tighten up. These patients have unstable shoulders. These patients need to have some stability back by getting them tight. I'm going to go slow with that person. Patients that have a firm or spasm end feel, I may be cautious in progressing them, but I need to progress them maybe a little faster than normal. I don't want them to get too stiff. So I'm always walking a fine line by assessing their end feel to make sure that they are progressing along that I think that they should. So again, I'm always balancing mobility with stability. There's a fine line that the therapist is walking. I actually have a patient right now I'm doing rehab on. This girl is a ballet dancer, dances for the Orlando Ballet, dislocated her shoulder, and we tried to rehab her, and in the process couldn't really get her better. Still had instability, still had pain. So they went in and did a repair of her Bangkok lesion, and I have taken her along very slowly. I keep reassuring her. She's 19 years old. Her shoulder does feel stiff now. She's 3 months out of surgery. Her rotation is still very limited. She's trying to get back to dancing and she's getting frustrated. But I'm reassuring her she has to stay the course. We need to keep her shoulder nice and tight because she has underlying laxity. The problem with these patients is they have too much elastin to collagen within their joints. So normal patients have more collagen than elastin, which allows them to have stability. And patients with an unstable joint, particularly multi-directional instability, they have too much elastin within their skin and within their underlying tissue. So the problem is they get loose easily. So my girl that I'm rehabbing right now probably is in that boat. I'm going to go slow with her, knowing long-term the elastin component of her tissue will eventually allow her to loosen up and be functional again. So keep that in mind too, that your patients that are loose jointed, you got to go really slow because of the amount of elastin that's seen in their joints.